Good morning, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health. Before I give my COVID update, I just want to say a few words about the ongoing conflict in Ukraine. Like many communities across Canada, the conflict is hitting very close to home for us. More than 20,000 residents in Mississauga are of Ukrainian descent. I've spoken with many community members and groups over the last few days, including the leadership at the Ivan Franko home, the Ukrainian Canadian Congress Toronto branch, and the Ukrainian Youth Association, and they're heartbroken, angered, and deeply concerned for the future of their country and the safety of their loved ones. The truth is that we're all deeply troubled. As a city, we've taken steps to show our unwavering solidarity with the people of Ukraine and our Ukrainian community. Last week, we raised the Ukrainian flag at City Hall, where we were joined by numerous speakers and hundreds of community members. I was very thankful that many of our councillors came out to show their support. I also attended Mass at St. Mary's Ukrainian Catholic Church with Father Pankyu and spoke at the rally at Nathan Phillips Square, where thousands of Canadians came together to send a clear message that we are all united in our strong condemnation of this unjust and illegal war. I've also had the opportunity to speak with Russian community leaders who are also deeply troubled and have expressed their support, and who are also fundraising for Ukrainian families. And yesterday, I brought forward a motion at City Council, seconded by Councillors Dasco and Fonseca, that passed unanimously, which sends a strong message that the City of Mississauga stands firmly with the people of Ukraine. The motion reiterates our support for the ongoing response from the federal government, while also encouraging them to do even more, and asks that all Mississaugans who can, including myself, to donate to the Canadian Red Cross, Ukrainian Humanitarian Crisis Appeal, and with all donations being matched by the federal government up to $10 million. I want to thank Immigration Minister Sean Fraser and Deputy Minister Chrystia Freeland for announcing moments ago that Canada will be fast-tracking visas for Ukrainians who wish to come to Canada to work and return home when it's safe, and expediting immigration applications. In addition, the federal government announced they will be introducing a new reunification program that will help Ukrainians who have family here to come here permanently. Right now, we're witnessing a pivotal moment, both in Ukraine's history, but also our collective history as free and sovereign nations. It is now incumbent on the international community to protect Ukraine and the fundamental principles of democracy. And now for my COVID update. The big news this week, of course, was the lifting of the remaining capacity limits and vaccine certificates in businesses and other settings. This is a pretty monumental step forward, given where we were in January. At the City of Mississauga, this means that we will no longer require visitors or those using city facilities to show proof of vaccination, and we will stop all active screening and contact tracing. This is consistent with the approach being taken by many cities across the GTA. These changes come into effect at a time where we are continuing to see improvements right across the board. Only 5% of people are testing positive on a PCR test right now. And Trillium Health Partners currently has 40 COVID patients, with just 6 in the ICU. To say we've come a long way in a short amount of time would be a huge understatement. I want to once again thank our hospitals and our healthcare heroes, as well as our frontline workers, including Mississauga Fire and Emergency Services, Peel Police, Peel Paramedic, ATU workers, and our city crews, who showed us the definition of resilience by continuing to deliver healthcare and services while facing unprecedented staff shortages. And to our residents who have and continue to show an incredible amount of patience and selflessness through another long lockdown, while doing the right thing by getting vaccinated and boosted, and followed all the public health guidelines. While we're no longer living with restrictions and lockdowns, it doesn't mean that COVID is over. We know it isn't going away anytime soon, but what's most important is that we have the tools to blunt its impact, and we are using them. I'm confident what lies ahead is an incredibly bright spring and summer where people can fully get back to doing the things they love, at a time when businesses can fully start the recovery process and once again thrive. As I said last week, we will continue to closely monitor the health trends. And while I hope we never have to move backwards, what gives me confidence is that we can respond quickly if cases were to move in the wrong direction. Whether that's continuing to provide paid sick leave to workers, wearing masks, making more boosters available, or once again requiring proof of vaccination in certain settings. I encourage the province not to hesitate to bring back these measures we know which are effective if we were to see a sudden surge of cases, and especially if our hospitals were to once again come under serious threat. Being proactive will ensure we never have to see another lockdown again. As we move forward, it's incumbent on all of us to remain vigilant and to continue doing the things we know work. And that includes, of course, getting vaccinated and boosted when eligible, wearing masks in settings where it's required, and of course, isolating when you're sick. Now, you may have noticed that I'm being a bit more reflective than usual today in my remarks. And that's partially because we're moving into a very new phase of this pandemic. But there's also another reason. And it's because this is Dr. Lowe's last scheduled press conference. Now, I want to be clear that that's a good thing. Dr. Lowe does not anticipate that our situation, at least in the short term, will change significantly. He will, of course, be available for updates if need be. Since the start of this pandemic, Dr. Lowe has had a singular focus, and that has been to do whatever it takes to keep Mississauga and Peel residents as safe as possible. And it's been an absolute honor to share this podium with you, Dr. Lowe, and to provide residents week in and week out with all the information they need to help navigate the pandemic. Including today's press conference, we've now done 85 COVID updates, and you've been with us for every single one of them, oh, well, except one or two when you needed a much-deserved break. It was back on April 8, 2020, when we held our first, and when we knew very little about what we were then calling the novel coronavirus. And it pains me to think of it now, but at the time, the city was told we needed to take drastic measures, such as closing down playgrounds, as we were still under the belief that the virus was spreading largely on surfaces. But with Dr. Lowe's help, we gained a much better understanding of the nature of the virus and what measures were actually effective at battling it. And it wasn't just here at these updates. Dr. Lowe made himself available to answer questions directly from residents at the numerous COVID town halls throughout the course of the pandemic, where he was always candid about the situation and Peel Public Health's response. I know that, like myself, many residents appreciate your honest and straightforward approach, Dr. Lowe. But what I admire most about Dr. Lowe is how strong and principled a leader he is. He's often been in the very enviable position of having to support and make some pretty unpopular decisions. But he did so knowing that it would ultimately help protect us, and it did. The reality is that for a good part of this pandemic, Peel Region was hit harder than any other part of this province. And it was because of this that Dr. Lowe at times had to go further than with health measures that even the province had put in place to better protect businesses, workers, and residents. He was a leading voice advocating for paid sick leave so that workers didn't have to choose between losing a paycheck or going into work sick. He oversaw our vaccine rollout, the largest public health initiative in this region's history. and he has continually found creative ways to get shots into arms of those who faced barriers to the vaccine. When the region was receiving less than our fair share of vaccines, despite Peel representing over 20% of all COVID cases, Dr. Lowe strongly pushed to get us what we needed. Dr. Lowe, truly, from the bottom of my heart, thank you, and thank you to your team for everything that you have done. You have been a strong and exemplary voice of caution and compassion. I will miss having you at these updates, and I'll of course miss your many metaphors that they have helped paint a vivid picture of what we were facing and what we needed to do. Dr. Lowe, you are truly a healthcare hero in every sense of the word, and on behalf of the City of Mississauga, and on behalf of the members of my council colleagues, we are forever grateful. But before you give your update, I would like to present you with something quite special. Dr. Lowe, just wait, I'm going to bring you up in 1 second. Dr. Lowe, this is a key to the City of Mississauga. It is our city's most prestigious form of honor and recognition, reserved and bestowed upon only the most esteemed community members. And since becoming mayor in 2014, I have only given out a handful of these. Receiving a key is a sign of great achievement and distinction, and it is given to an individual who has positively impacted and changed our city for the better. And Dr. Lowe, because of the extraordinary efforts to keep our community safe during this unprecedented health crisis, it is my absolute honor and privilege to award you with a key to the City of Mississauga. Please come on up.
Thank you, Your Worship.
You're in front of the camera.
I'm grateful, Your Worship. Thank you so much.
Up here.
Thank you very much, Your Worship. And good morning, and thank you to everyone in Mississauga. It has certainly been an interesting 2 years, but one in which I think we all came together. Ultimately, what we accomplished was not mine alone. I think it took a tremendous team, and this honor really represents, I think, the work of many hands that have really truly made a difference in shifting the risk around COVID from what was formerly catastrophic, as Mayor Crombie noted in her reflections, to something that I think, with some common sense and our continued collective efforts, can continue to move forward and move past. So I'm finding it difficult to find the words, but I'm certainly grateful for this honor that's been bestowed upon me, as I view it as being bestowed upon the many people I've been privileged to work with and partner with throughout this pandemic response. So good morning, Mississauga. We are seeing the Omicron wave resolve in our community. And as Mayor Crombie has identified, this will represent, for the moment, my final scheduled press appearance here in Mississauga. For members of the media, I would indicate that any further questions or inquiries can be brought through our communication specialists within my office, and we will certainly engage where and how any remaining decisions in respect of the ongoing response emerge. But I want to be very clear in my final remarks that even if we're coming in for landing, or what seems to be a landing, there will be a few bumps along the way. So I urge everyone to remain patient and vigilant as we continue to navigate forward on this transition. Peel Public Health continues to monitor trends, so please be assured that we constantly are making sure that we can provide the best advice and recommendations as we continue with this transition. And I want to make very clear that we won't hesitate to act should the situation warrant. However, what is most important in this situation, as contacts are anticipated to increase with reopening and more usual interactions return, I really strongly urge all residents to get vaccinated and boosted without delay to protect our progress and to protect yourselves and your loved ones and your community. That's 2 doses for over fives, and a booster if you're over the age of 12. Getting vaccinated and boosted is the best protection against Omicron, and you can walk in or book online at peelregion.ca/COVID-19 vaccine. You can find a clinic. We are accepting walk-ins if you need a first, second, or booster dose. I also want to ask you to continue to mask for the moment in public settings, and also to stay home if you're sick to reduce the risk of spread. And on that, I want to clarify some reports around comments I made yesterday in respect of masking. Masks have been an important life-saving intervention throughout the pandemic. At a time where we didn't have vaccine, they helped to reduce spread and therefore limit the cascade of severity. And together with provincial partners, we are continuing to review current regulations and ensure a coordinated and consistent approach to masking in Ontario. At this time, however, Peel Public Health continues to support regulations that require masking indoors and compliance with them in public places where feasible. We're not fully out of the woods yet, so for the time being, especially important with the reopening that occurred on Tuesday, it is extremely important and vital to continue with masking for the moment while we monitor for any changes in our trends. It is also worth noting that even if the regulations do change in the future, wearing a mask may well continue to be a good idea, depending on the individual and the situation, or if high levels of transmission resume in our community. In ending my scheduled appearances then, I also want to reflect on the longest emergency response in Peel's history as a region. We certainly mourn those whose lives were lost or altered by infection with this novel virus. As we do, though, we know that the pictures of tragedy seen elsewhere remind us that many more of our loved ones could have been lost had we not come together. By coming together in Peel to stay apart initially, then to mask and get vaccinated, we have kept each other safe, and we've done so especially given Peel's unique challenges compared to elsewhere in Ontario and globally. Our community context may have necessitated a more cautious approach in the initial days of the pandemic, but it was those sacrifices that saved lives and prevented the catastrophes that we had seen elsewhere. So for that, I say thank you. Again, I thank you, Mayor Crombie, and all your council colleagues for your constant leadership and support in keeping our residents safe and informed. It has been an honor and privilege to work with you and all of council to serve our community. And I'm looking forward to tackling this transition as well as other new public health challenges ahead. I do want to thank my Peel Public Health and Region of Peel team. Whether you've been fighting the virus, vaccinating, or keeping other critical health services afloat, you've gone above and beyond to protect our community. Your work has demonstrated the importance and strengths of Ontario's local public health units and local public health system. I want to thank all of our partners for your collaboration, among them hospitals, healthcare system partners, first responders, schools, local businesses, local municipality partners, community agencies, and our provincial partners. And I would be remiss if I didn't also take a moment to thank those in my personal life who have supported me, my family, my friends, and certainly those who have been a listening ear throughout difficult times. Finally, to all of you residents, I wish to offer my thanks as well. Your collective actions to stop spread, stay masked, and get vaccinated and boosted have made a difference. It's a privilege to serve as Medical Officer of Health for the Region of Peel, and while I'm not certain and it's impossible to fully tell what the future is going to hold or whether some measures might return, I know that we will continue to work together, and I know that we continue to remain vigilant. I also know this, and I'll leave you with this final message. Getting vaccinated and boosted is how we can continue to make it through for the moment, to continue to have certainty that our interactions can start to resume as normal. So please get vaccinated and boosted today. Take the risk of severity out of any COVID infection, and let's continue to move forward. Again, my thanks, and again, thank you, Madam Mayor. I'll pass it back to you.
Don't forget that. There's
Yes.
a box there, too.
Oh,
Little box for you.
thank you, Madam Mayor.
Oh, my pleasure. Oh. Thank you, Dr. Lowe. I do just want to briefly talk about a significant transit announcement from earlier this week when I joined the Associate Minister of Transportation Stan Cho, Education Minister Stephen Lecce, and Associate Minister MPP Nina Tangri. Starting on March 14th, MyWay riders connecting to and from GO Transit will only be charged the GO fare on their Presto card, eliminating the double fare. This is big news and will save our residents on average $250 per year if they use the service 3 times a week. As part of this announcement, the province also increased discounts for youth and post-secondary students who ride GO. I want to thank the Ontario government and Metrolinx for their commitment to making transit more affordable for our residents, and to our staff who work closely with them to get this done. The elimination of the double fare in particular will also make it easier for people to move across Mississauga and beyond to explore more employment in neighbouring regions, helping both those looking for jobs and employers looking for workers. This is a big win, and we hope that we can continue these conversations to integrate fares between the 905 transit services and the TTC in the future. Lastly, I want to invite everyone to my 6th annual International Women's Day celebration on Tuesday, March 8th from 8 a.m. to 9:30 a.m., which will be held virtually this year. And I'm thrilled to announce that we will be joined by Mississauga's Katie Vincent, who won Olympic bronze in the C2 500 canoe event at last year's Tokyo Summer Games. With this year's International Women's Day theme being Break the Bias, Katie will speak about overcoming the barriers women face in sport and what it was like being part of a movement that finally led to the inclusion of women's canoeing in the Olympics. You can register for the event by visiting my social media channels. And now, along with Dr. Lowe, for perhaps the final time, we are here to take questions from the media.
Mayor, your first question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Hi, Mayor Crombie. How are you?
I'm very well. How about you?
Too bad. A question for yourself and perhaps Dr. Lowe as well. It'd be good to have him chime in on this. But as far as I understand, the Mississauga's mandatory mask bylaw is expiring at the end of this month. Just wondering your thoughts on whether you see it being extended, whether you see it just expiring and the bylaw be gone, or if you think it will kind of end via council kind of resolution before it expires at the end of this month.
It's an excellent question. It's one we're giving a lot of consideration to, and I'll be honest with you that we're waiting for the pronouncement from Dr. Kieran Moore. We understand that the province is evaluating the use of masks and in certain situations, whether they be low risk or high risk, and certainly the city would follow suit once we heard what the provincial announcement may be. So Dr. Lowe, is this something you'd like to comment on as well? I'll ask him to come to the podium.
Yes, thank you, Madam Mayor, and thanks, Steve, for the question. As I mentioned in my remarks, for the moment, we still continue to support public masking in indoor spaces as much as is feasible and possible, depending on the activities that individuals are engaged in. However, we are currently working with our provincial partners to determine a consistent and coordinated approach to masking. It is important to note that we did just have a major reopening on Tuesday, so I think at least for the moment, in the next couple weeks, it would be prudent to not make any other broader population level changes while we evaluate the impacts of the recent lifting of capacity limits and the end of the proof of vaccination system. So, certainly those conversations continue. We will, of course, attempt, though, as much as possible to coordinate with the province to ensure a consistent application of this important measure across the province, and also to highlight that even if the bylaw regulation goes away, it may still yet continue to be a good idea for certain people or individuals and in certain settings for masking to continue even with the current levels of transmission we have here. So again, we'll continue to work with our provincial partners and hopefully move in a consistent manner while we evaluate the impacts of the recent reopening. Thanks so much for the question.
A follow-up for you, Dr. Lowe. Just in terms of from a public health perspective, what would you say is kind of the benefit of the mask bylaw at this point, and also I mean, what would be the harm in kind of extending the mask bylaws for several months, or weeks, let's say, knowing that we're not quite out of the woods yet?
Well, as we know, masks continue to help to limit spread to a certain degree, particularly, better quality masks with Omicron that are circulating in our community. So, that is a benefit that is provided, and it's mostly really at this point protecting those that remain unvaccinated. We know that people who have 3 doses of vaccine, vaccinated and boosted, are at significantly diminished risk of severity against Omicron, and so I would say, you need to look at all the measures in suite, and the reality is, with the Omicron variant circulating, far be it just to focus on the masks alone. I think we really should be trying to get people who haven't been vaccinated yet to understand that, all of these measures were guardrails that were intended to limit the possibility of transmission and severity if they were to come face to face with a COVID-19 infection. You can take that away by making sure that you get vaccinated and boosted. Thanks for the question.
Next question, please. And actually to Steve and the others who may be watching, we do plan to continue our weekly updates, unfortunately just not with Dr. Lowe, but we'll still try to make it interesting for you.
Mayor, your next question comes from Declan Finnegan at Mississauga. Go ahead, Declan.
Thank you. Good morning, Mayor Crombie. How are you?
I'm very well. How about you, Declan?
I'm fine, thank you. Maybe this is a question for both you and Dr. Lowe.
Sure.
How has the pandemic, specifically Mississauga's and Peel response to it, better prepared you, the city, and Peel Public Health for the next pandemic, whether that be 5, 10 years, 30 years down the road?
Yeah, it's an excellent question. It has helped prepare us for any crisis, frankly, not just a pandemic or a health nature, or sorry, a crisis that is of a health care nature. So I think what we have seen is a greater collaboration, not only amongst my colleagues here, but at all 3 levels of government. It has really helped us prepare. And I think that is the one critical learning that has come from this. What else can I say? We learn to manage, that we can manage through a pandemic while managing the day-to-day business of the city. And finally, I would say that what it showed us was the resilience of our people, the spirit of Mississauga that rose to come together through the crisis. And if I may, finally, just that people really step up when they have to. So just my utmost praise for our healthcare and frontline workers. And this is everyone from the hospital workers to Peel paramedics, Mississauga Fire and Emergency Services, Peel Police, ATU, frankly, even people at the grocery stores. People stepped up when they needed to and showed how compassionate and resilient they were in helping those who were more vulnerable and in need. Dr. Lowe, perhaps you want to add something?
Yeah, thank you so much for the question. And certainly there will be lots of lessons and reflections coming out of the pandemic. I think one thing I want to make very clear is that for those of us in public health, especially working at local public health units, pandemic preparedness is something that we've engaged in. I think there were lots in respect of specifically COVID-19. There are certain characteristics, and every pandemic is driven by the nature of the disease. I think there are certain characteristics that made this virus particularly pernicious, particularly difficult to control, even beyond some of the planning and anticipation that existed in our emergency preparedness plans. But I think the reality is we responded. The work of public health units ultimately, with the tools we had and the resources we had, together with all the partners that we worked with, we were able to address it in the best manner we could, given the context that we were dealing with here in Mississauga and the region of Peel. So I think there will be lots of lessons learned out of this, but the biggest thing that will really be important to tease out will be how much of the challenges that we faced were just a function of the disease being an extremely contagious, a very challenging disease, and how much of it were things that could be done done differently. In essence, for example, a Category 5 hurricane coming through, there are things that you can do differently, but there is also a recognition that there will be significant challenges faced no matter how prepared you are. Thanks so much for the question.
Next question, please.
Declan, do you have a follow-up?
Yes, I do. Thank you. Mayor Crombie, there's so many projects, major projects in Mississauga happening at this time, whether, from the public transit projects to the new hospital and Port Credit Marina and et cetera. Some residents are kind of skeptical that all of this is not going to get done without somehow resulting in tax hikes for them. How can you maybe sort of explain those projects to people in a way that I guess they'll see that there's not going to be a huge tax burden on them?
So that is a very good question. And, as you know, we have limited resources, limited sources of revenue here at the City of Mississauga. We've been asking the provincial government to reevaluate the revenue tools cities are given. However, you also know that we rely on the provincial and the federal government when it comes to those very aspirational projects like the LRT, like the marina, like the hospital rebuild, because it is not within the capacity of the city to deliver those projects, certainly not within the revenue structure we currently have. So it's incumbent on them to fund them. And as you saw, we had a large announcement about the hospital rebuild. The provincial government is funding the LRT as well, where they are now looking at how we can rebuild the loop back into the hospital, back into the transit loop, the loop around the downtown. We've also applied for funding for the marina. So we do try to keep our taxes reasonable, manageable for all our residents, including our seniors and our young families, and we try to keep it in and around the rate of inflation. And as you have seen, we are below average for the average GTA municipality. Of course, Toronto is lower only because they have other sources of revenue. They have different revenue tools available to them. So we will always strive to keep our property tax rates very manageable and in and around the rate of inflation, although I do believe in reinvesting in our city. So, I'm not one of those politicians who will promise you zero, because I want to invest in transit and invest in infrastructure. And so as a result, I think we do need to increase, to put some money aside for debt repayment and to build our economy and to build Mississauga.
The next question is for Dr. Lowe from Anne-Marie Tricky from Radio Canada. Anne-Marie, go ahead with your question.
Bonjour Anne-Marie, avez-vous une question?
Oh, sorry, I just have to unmute her here.
Hello. Yes, thanks for taking my question, Dr. Lowe. So ideally, if you could answer in French, that would be amazing. Okay. So I'm going to come back about masking, particularly in schools. So there was a statement that came out earlier this week from the children's hospitals in the province saying that, it's not time, and that because children are less vaccinated and some are ineligible, we shouldn't be really thinking about that. Of course, you've mentioned that we're going to be reviewing that in the next couple of weeks, but I'm just wondering, what's your reaction to that? What do you think about masking in schools more particularly?
Yeah, thanks for the question. Merci beaucoup pour la question, Anne-Marie. Le masquage, je pense que c'est très important d'avoir une approche consistante dans notre communauté. Nous savons qu'il y a un grand déconfinement qui a été passé cette mardi passée. Et avec le ministère, avec le ministère de la Santé et notre partenaire, je pense que c'est très important de prendre compte de toutes les mesures dans les écoles, mais aussi dans la communauté. Tout ensuite, après une opportunité de suivre les tendances après le déconfinement. Alors, je pense que pour ce moment, c'est important de continuer le masquage dans les écoles et dans la communauté. Et de donner une réponse dans les semaines prochaines. So I'll just say it again in English. So I think it's really important, just schools and throughout the community, that we do need to take a measure of all the various measures to ensure a consistent approach. And so we're continuing to work with the ministry around the approach on masking while we really monitor the outcomes of the reopening that occurred on Tuesday.
Great. And if I can just follow up also in French as well. You know, the province last week said that if they're going to lift masking in public places, it would most likely also be in schools. I'm wondering if you think we should keep masking in place longer in schools, if schools should be considered high risk, sort of how you see that situation.
Oui, merci pour la question. Je pense que nous avons beaucoup des enfants qui sont maintenant vaccinés avec son première dose et beaucoup avec 2 doses. Pour des jeunes de 12 ans à 17 ans, où nous savons qu'il y a plus de 90% de personnes, de jeunes de 12 à 17 ans avec 2 doses de vaccin. Et ils peuvent accéder aussi une dose de rappel. Et je pense que à ce niveau à ce taux de vaccination dans notre communauté scolaire, ça donne beaucoup de protection avec le masquage pour ce moment. Et si les tendances continuent de rester stables dans les prochaines semaines, on peut considérer les autres bienfaits de continuer ou discontinuer avec le masquage à ce point. And so I'll just say it again in English. I think we have a school community where we have 5 to 11s now, 50% with first dose. We have 12 to 17 with over 90% with 2 doses. And also now they can access a booster dose. And so I think it's important, of course, to get those numbers up to continue. But it really does shift the risk in the school community with those levels of vaccination coverage. I think that's all. Merci beaucoup pour les questions. Thanks for the questions.
Are there any further questions?
Yes, your final questions come from Khaled Salama at My Second Home TV. Go ahead, Khaled.
Welcome, Khaled.
Can you hear me?
Yes, we can. Please proceed.
Oh, very well. I cannot hear you anyhow. So thank you so much. Let me start with Dr. Low and say, actually, there were times we didn't like your health restrictions, but we always respected your honesty and leadership. Thank you so much, Dr. Low. And the question also, let me start with Dr. Low and come back to you, Mayor Crombie, please.
Thank you, Khaled.
Dr. Low, what was the major component or factor that impacted our healthcare system during the pandemic, and how you would like to see this fixed?
Khaled, it's a really great question. I think one of the biggest challenges that we had here was this is a disease that spreads from person to person. So it's not surprising that a disease that spreads from person to person will find significant purchase in a place where there are lots of people, and particularly where there are lots of inequities and disparities, where people cannot necessarily isolate from home, reduce their contacts, and stay safe, especially in the pre-vaccine era. We know that we have significant goods movement and distribution economic activity that has grown up around Pearson Airport, and ultimately we are here in Peel Region the central hub that distributes to Canada. I think our residents here in Peel, to a large extent, we went to work while to keep the rest of Canada, to some extent, home and safe throughout the pandemic. I think related to that as well, we know that Peel Public Health is the lowest per capita funded health unit in the province. We also have, hospitals. That has been another big factor. At one point, our hospital in Brampton was transferring hundreds of patients out. Trillium was also transferring patients just because the investment in this community, and certainly recognizing, speaking for the public health unit, hasn't kept pace with the significant population growth that's occurred in our community. We know that Peel is a wonderful, diverse community, a great place to live and work and play. And I think those were some of the big challenges that we faced that necessitated some of the more significant measures when we were a largely susceptible population. And I know you're making your comment sort of tongue-in-cheek, but the reality is, we had to. I think any other medical officer of health who was in my position, and with the training that I have as a public health and preventive medicine specialist, if they saw some of the trends that we were seeing, the data that we were challenged with, all the disparities that we were tackling, ultimately any emergency plays out on the ground that it lands. And I think that any other medical officer of health would have taken the same steps that I did, to ensure that we were keeping our community safe. We saw what happened in many other communities elsewhere that tragically didn't get the same balance right in respect of contacts and protection, and certainly our thoughts are with them, as our thoughts are also with people who were impacted throughout this. But I think seeing our community come together, the resilience and the opportunity to really keep each other safe. 90% of our community, 12 plus, is double vaccinated, which is ahead of the provincial average for that group. I mean, it really speaks volumes to how we overcame many significant structural deficits in our community. Thanks for the question.
Bless you, Doctor.
Is there a follow-up?
Yes, Mayor Crombie, please. Many reports talk about some clashes between the Ukrainian and Russian-Canadian community here in Mississauga and some other places also in Canada. And the more disturbing reports were about some bullying incidents on school against young kids. Only for having the names Putin or Vladimir. What do you think you can do to prevent such unfortunate incidents? And we are all Canadians.
So this is incumbent on all of us to, tensions are high right now, is to de-escalate the situation here in Canada. We have people here from every culture, from every part of the globe, and we live together here peacefully. And it's important not to bring the home politics here to Canada. I've spoken with members of the Russian community. They're out raising money and medical supplies and equipment for Ukrainian families, whether here or at home, to send back to the Ukraine. I think it's very important that we be kind and compassionate to one another right now. Thank you for
That was your final question. Oh, that was your final question for the day.
Thank you for joining us today.